Let's read the last line in this question. So, which of the following is incorrect in regard to procedure being performed in the given image? So, the question here is a 45-year-old female complains of food lodgement in her right lower back teeth region. Intraoral examination reveals interproximal caries present between right mandibular molars. Class 2 amalgam restoration is done by the dentist. So, we have to find out the incorrect statement about the procedure shown here. So if you see this, you will be able to understand, yes, that is going to be the class 2 cavity, and this is the proximal surface, and at the same time one keyword here is the blade, and then you have the access. Okay, so you can see a blade is inserted somewhere here, and excess of the amalgam or the restorative material is being removed, right? And if you see the other figure here, you can see the stroke direction, right? So here should be the stroke direction like this, right? And you can see the proximal overhanging extra material or the excess material is being removed by using this particular instrument, and this is none other than the amalgam knife. So that is going to be the amalgam knife. Okay, so basically we are using amalgam knife here, and we'll be coming to the uses of amalgam knife as well. Before that, I should tell you the use of or the various instruments which are used in the amalgam restoration. So first of all, we have the diagnostic instruments. So what are the diagnostic instruments? Mouth mirror. We all are familiar about mouth mirror. Then we have probes, then we have tweezers, right? Then comes your isolating instruments. So generally we use rubber dam, cotton roll, then we use saliva ejector, and then suction. This is saliva ejector, and then suction apparatus, or we just call it as suction, right? Then we have instruments which are used for caries removal. So the primary instruments here are going to be your aerator and your burrs. At the same time, we can also use the spoon excavator for removal of the caries, right? Spoon excavator for removal of the remaining caries, okay, which you cannot do in high speed, right? Then we have shaping. Now in this, what we do for class 2 cavity preparation, the burr set which is used and their function is in shaping of the cavity. So we know we are going to use a burr set. So burr can be burr number 330, 245, 169L. Okay, these are the various kind of burr which we use to give a proper form to the your cavity, right? Then yes, other hand instruments are going to be chisels, enamel hatchets, then you have GMTs, then you have angle formers, then you have knives. Okay, now I'll be just elaborating these knives after I'm done with the restorative instruments. So the restorative instruments are going to be mixing instruments. Now what are the mixing instruments? It can be cement spatula, agate spatula, mixing glass, whatever we are using, right? Then you have the carrying and filling instrument. Okay, so we have the filling instrument as well as the carrying instrument. So amalgam carrier is going to be your carrying instrument here. Then we have the condensing instruments, then the condensers, then yes, the carving instruments. In the carving instruments, you are going to have Hollenbeck carver, diamond carver, Watts carver, and then you have, if like basically just these are the instruments, right? And then the polishing instruments, right? So now coming to the knives. So if we just talk about the knives, the various types of knives which are used in the amalgam curing actually. So these are used in trimming the excess restorative material. Excess of the restorative materials, and these restorative materials are going to be removed from proximal surface generally. So from the proximal margins, proximal margins, we are going to remove the excess material, and this is particularly done in case of class 2 as well as class 5 cavities. Okay, so these are the various instruments which we have seen. So if we just see here, this is going to be your amalgam knife, and this particular is used for removal. The first and very most function is the removal of the excess or the proximal excess material. The second important function is going to be to give a embracer form actually. So that will be giving the, or basically you will be giving the, or refining actually the embracer form, and this particular embracer form is going to be the gingival, right? Remember, it is going to be gingival, not lingual or facial, right? And at the same time you will be having a proper proximal contour, right? Proper proximal contour, right? That's why you are refining the proximal area, because you want to create a proper proximal contour, and once you create the proximal contour, yes, you will be having a better gingival embracer as well, right? So if we see the various options here, so the first option is removal of the proximal excess. Yes, that is the function. Refining of the proximal contour, again it is a very important function of the amalgam knife. And then refining the gingival embrasure is also a function. But if we see, the developing the facial and lingual embrasure form is not particularly the function of the amalgam knife, and is not shown in this procedure as well, and that's why your answer is going to be 4. That is, this is the exception of this particular the use of this particular instrument, right? So yes, walking through the explanation quickly, amalgam knives, we call these number 34 and number 35, and these are ideal for removing gingival excess to prevent gingival overhangs. Yes, they are also ideal for refining the embrasure form around the proximal contacts. The secondary edges which are there, they can be used with push stroke as well as pull stroke, and they are occasionally helpful whenever you are doing these particular strokes movement, right? Again, we have a carver which is used for carving of the enamel, that is the Hollenbeck carver number 3. This occasionally can use as the side of the explorer, may be suitable instrument for carving these areas. So yes, going back to the question, answer is going to be the option 4, that is developing the facial and lingual embrasure form is not going to be the function of this particular procedure shown in the figure.